Hi, and welcome to another edition of PACE Monthly. Today we're going to be talking about healthcare and health insurance, and with us we have Nikki Conti, who is the Associate Director of Public Outreach and Education for the Massachusetts Health Connector, and Sarah Bonapane, who is a Senior Outreach Coordinator of the Massachusetts Health Connector. Welcome to New Bedford.
Thank you.
Thanks so much for having us.
Okay, so tell us what exactly the Health Connector is.
So Sarah, do you want to start?
Sure. So the Health Connector is a quasi government agency, and the role that it serves in Massachusetts is the state marketplace for health insurance. So the Health Connector is compliant with the Affordable Care Act, and we are the marketplace in Massachusetts for individuals who are seeking health insurance to come and purchase. We're also a marketplace for small businesses in Massachusetts who are seeking to purchase health insurance for their employees.
Mm-hmm. And there's a lot of discussion nationally and locally and on a state level about health insurance, the Affordable Care Act, the repeal of the Affordable Care Act. But Massachusetts has been a leader for years in the field of healthcare and universal healthcare. So Nikki, can you talk about some of the history of Massachusetts and why we're such a leader in the country?
No, absolutely, and I'm glad you asked that question. So back in 2006, Massachusetts passed a healthcare reform law, and part of that included language which required folks to, for those who could afford it, it would require people to have health insurance coverage. So because of that, an agency was formed, the Health Connector was formed. And yes, I'd love to start over with this question, but I'll keep it going. This agency was formed, and sorry, Bruce.
That's all right. We had the individual mandate first.
Yes, we had the individual mandate first, but then we, in order to implement the individual mandate, we had to form an organization, and part of that was actually creating a marketplace where individuals could purchase health insurance in a bit more of a transparent manner than they could before. So this is prior to the Affordable Care Act, kind of looking at Massachusetts healthcare landscape. We were really well positioned in the market to put this in place in Massachusetts.
Mm-hmm. Is it safe to say that most people get their health insurance through their employer?
I would say yes. A large majority of consumers in Massachusetts residents do get their insurance through their employer. If not through their employer, through their a spouse, family member.
Right. And low-income people are eligible for Mass Health, which is, I don't want to say free, but is low-cost health insurance.
Yep.
So the people that we're talking about that would go to the Health Connector are the people who are in the middle, the people who don't have health insurance or affordable health insurance offered through their companies or their workplace, or would people on unemployment be eligible for the Mass Health Connector?
Yes, they are. So if we think back and thinking about traditionally the folks who might have been eligible for Medicaid, it was found that there was a subset of people who couldn't get health insurance coverage through a family member or through a job, and they were kind of left behind. So with Chapter 58, really, what it did is it created an opportunity for folks who were working but maybe weren't working enough hours. A lot of people who are maybe have a couple of part-time jobs, created an opportunity for them to access health insurance coverage, not Medicaid, but get access to commercial health insurance coverage with lower premiums associated with them. So I think that's one of the reasons why this actually worked quite well in Massachusetts, because we were able to give people, for the first time, we were able to provide them something that they wanted, but there wasn't necessarily legislation in place to kind of have these programs be available to them.
Mm-hmm. And it's relatively complicated because there are different levels of insurance that you can purchase into. I know there's silver level and platinum. I believe that, at least some of the training I'd gone through. So Sarah, talk a little bit about the choices that people would have when they go to the Health Connector on the type of insurance they can purchase.
Sure. Well, sort of building off of Chapter 58 was the National Affordable Care Act, or the ACA as we frequently call it. And the ACA created some different, what we call metallic tiers for individuals to purchase. So there's different levels of coverage associated with different metallic tiers at the Health Connector. So we have a bronze, silver, gold, and platinum tier available, and also a catastrophic plan for individuals who we define as young adults. And those different tiers or metallic tiers cover different amounts, based on what you're looking for or what somebody's needs are for coverage. So, a platinum tier is going to be the most amount of coverage that you can purchase, and that'll likely come at a higher premium cost. And then a bronze tier would be a lower level of coverage, but that would come at a lower cost. Or you could purchase something in between, that fits you or your family's needs.
So the Affordable Care Act has mandated that everyone has to have a certain type of coverage, and these plans meet that coverage. If I remember right, part of the problem prior to the ACA, or as some people want to call it, almost a pejorative term, Obamacare, like this some big nasty thing, people could buy health insurance that really didn't cover them when they had problems. So they'd be paying premiums, but when it came time to get coverage, they didn't have that. So I guess the Affordable Care Act established minimum credible coverage that insurance companies had to meet.
So just a point of clarification, I think I'll ask Sarah to actually fill in with some policy as well. But the Massachusetts mandate actually set minimum credible coverage standards, and what the Affordable Care Act did is they set national standards for essential health benefits. So interestingly, Massachusetts MCC standards actually, I don't want to say a little bit more strict, but give the carriers more requirements around comprehensive coverage. It's actually, maybe that's a better way to say it. It's just a little bit more comprehensive than the essential health benefits. But basically, with our Massachusetts law and national law, what we're doing at the Health Connector is we're able to ensure that all of the health plans that are sold on our product shelf actually meet both state and federal standards, and people can feel assured that if they're buying health insurance coverage through us, that they're getting solid plans.
Right.
The Health Connector doesn't actually approve rates. That's not part of our job, but part of our job every year is to go through a seal of approval process where where carriers basically bid to sell their products on our shelf. There are a series, I won't even get into the requirements, it's pretty complex, but there are requirements, and they every year have to basically resubmit to us. We work with folks our organization works with Division of Insurance, and then our board goes through a process of reviewing, and our staff and board go through a process of reviewing and approving all the plans that are sold on our shelf, so sold each year.
And are they carriers that we would know, names that we would know?
Yeah, so they're all, they're all the major, I shouldn't say all of them, but each, we have several carriers in Massachusetts that are major insurers within our state, within our market.
Mm-hmm. Mm-hmm. And I'll just throw such as Blue Cross Blue Shield, which is a
Correct.
name that pretty much everybody,
Yeah,
Harvard, Pilgrim,
Pilgrim.
those type of,
Mm-hmm.
that people pretty much know. Mm-hmm. One of the most contentious parts of the Affordable Care Act, and I guess the Massachusetts law, is the individual mandate.
Mm-hmm.
Talk about the individual mandate and why I'm not sure it's controversial. Some people object to it. They feel that this is a government telling me I have to buy something that I don't need. Yet the same government will tell you have to insure your car.
Right. So I feel like this is interesting. Actually, we were discussing this on our ride here this morning. I think initially, yes, right? It's like, initially when I sat down, I started talking about Massachusetts having this law since 2006 and having us enforce this prior to the Affordable Care Act coming along. Initially, we didn't know how folks were going to react to it. Yes, it is controversial. Yes, government is coming in and saying you need to do this. But what we've been trying to do over the years is say, yes, it's something that we are asking you to do, but try to look at it a little bit differently. Try to look at it a little bit holistically. It's there are health benefits, health services that you are able to access For many, some people choose to go without health insurance coverage, and unfortunately, there are people who suffer financial consequences if they do make a decision to not go with coverage. So yes, it's controversial. I'll say yes, it is controversial, but it has no. Oh,
Yeah.
go on.
I'd also say, there's also something called tax credits, or in many cases, advanced premium tax credits. And those tax credits can actually reduce the cost of the monthly premiums for individuals who have incomes up to, a certain amount of the federal poverty standards. So while there is a mandate for every individual to have health insurance, there's also a lot of financial assistance available out there to help people to purchase that, such that some of our members with lower incomes have $0 premiums, which is the amount that somebody would pay every month, or very low premiums, that are less than $10, depending again on their income for their family and other life circumstances. But those tax credits are meant to make this a little bit more palatable and easier for people to be able to go out and purchase this health insurance, that has been mandated that they go and buy. And it's very comprehensive, as Nikki was saying. The plans that we sell, because of the laws that are put in place, have a lot of the benefits that people would need for preventative care, primary care, or advanced care. If someone has a chronic condition, cancer, it would cover them in those situations as well.
So one of the things that I try to talk to people about when they complain about the individual mandate, it's usually the people who are, I don't want government in my life, yet without health insurance, if you get injured, someone pays, and it's the rest of the consumers. We all know that the cost of health care now. If you have a week stay in a hospital because you broke your leg or you tore your Achilles tendon or whatever it is on an accident, you don't have insurance, you're talking in the tens of thousands of dollars the bill. So if you're unable to pay that, someone has to pay that. The hospitals can't just say, well, that's all right, you don't have to pay. So the other consumers, the other people who buy health insurance end up, through their premiums, paying for that. So it really is a situation where the government is saying, look, you need this, and there are different levels of care, and it's something that you should have, and if you don't, you get a penalty. And you pay a penalty that will help, I guess, cover the cost of if you do get sick or if you do get injured. So let's go into that a little bit. Recently, on a national level, the president has, I think, signed an executive order that eliminated the individual mandate on a national level. So how does that affect folks in Massachusetts?
So I think, so I'll start off with this. I think it's going to be it's really important for people to understand that although that has been signed into law, and from a national perspective, Massachusetts has not repealed its own individual mandate. So technically, and please correct me if I'm wrong with any of this, technically, a consumer, if they chose not to have health insurance coverage, they would be penalized on both their federal taxes and then you would think on their Massachusetts tax. However, they can't be penalized twice, or they weren't able to be penalized twice. Now, with the elimination of that at a federal level, consumers in Massachusetts still will face a tax penalty if they choose not to have health insurance coverage. So we think, so not to go on a tangent, but I think it's really important for people to hear. We think it's incredibly important for people to understand that there's some, not misinformation, but they need to know that we're in a different situation in Massachusetts than other parts of the country.
And I'm not sure people do. Healthcare is very complicated, regardless of anyone trying to simplify it. It's extremely complicated. You were talking about some of the policy implications, and it's just incredibly complicated. But we run a tax program, a VITA program. It's a
Right.
volunteer income tax assistance program, and every year we'll get a handful of people or a dozen people that don't have health insurance, and they get penalized either from the federal government or prior to that would get penalized from the state. And a lot of them say, well, it's cheaper to pay the penalty than get health insurance. And I look at their income and I said, no, it's not. And going back to what Sarah talked about, there are subsidies. There are subsidies to help you or help health insurance become more affordable, especially on the lower income scales.
got it.
But if I remember right, the premium tax credit covers people up to 400% of the federal poverty level.
You got it. You got it. So I just want to piggyback on something Sarah had said before. So she was talking about the Connector Care program. I don't think we named it, but I think it's important to name it because the Connector Care program is a program that's unique to Massachusetts. What it does is it takes, the premiums are lower because it takes state and federal subsidies into consideration. And that's what helps us in Massachusetts keep the costs as low as they are for consumers. But in addition to the Connector Care program, the Affordable Care Act extended or expanded or made advanced premium tax credits available to those with incomes between 300% and 400% of the federal poverty level. So that is something that we think is still, important to communicate to folks that maybe you didn't think you qualified for a Massachusetts program before, but at a federal level or because of this federal opportunity, you might in fact be able to get some of these tax credits to offset the costs.
Mm-hmm.
And for those individuals who say or believe that it is cheaper for them to pay the tax penalty, in some cases that may be correct, but the best thing for them to do is to come, to the Health Connector. We have an online application. It's mahealthconnector.org, and do an application. It's not a binding application. You can complete the application and then see what you may be eligible for, and then individuals can see the monthly premiums that they have available to them, and then decide. Maybe there is a premium that they can afford that is less expensive. Maybe they do have access to the Connector Care program or other tax credits that can help reduce that cost. And applying and being eligible does not mean that you must enroll, although we would encourage individuals to enroll because we do still have the mandate in place. But, if you're doubting whether it's worth it, it's always good to go and see, and then you can make that decision for yourself.
Well, I talked to this individual and I looked, because I was doing his tax return, I could see what his income was, and I knew he
Right.
was eligible for generous subsidies and
Right.
that he wouldn't be paying a lot. He said, well, somebody told me I'd be paying $200 a week and I can't afford it. And I said, look, I see your income. I said, look, we have navigators here at the organization.
Right.
I set him up with an appointment with a navigator, which is a segue into my next
Go for
set
it.
of questions. So that you could sit down with someone and, as you said, look at your options and look at what this will cost you. Because I said to him, I said, the reality is, I said, yeah, you're going to pay a penalty. I think his penalty was $900. And say you're going to pay a penalty this month. Your tax return is $900 less because you didn't have health insurance. But if you stepped off the sidewalk the wrong way, you tore your Achilles tendon, which happened to a good friend of mine, exactly that situation. He had health insurance. I said, without health insurance, you're looking at tens of thousands of dollars that you're not going to be able to pay for, and that you're going to carry this debt for years. And I said, please. So we set him up. So let's talk about the outreach, which is really what
Yeah.
both of your function is at the Health Connector.
Right.
So what does the Health Connector do to promote the plans and to promote what we can offer in Massachusetts?
So there are lots of ways in which we still conduct I would say public awareness. We have different outreach and education campaigns that have been going strong for years. Initially, of course, we needed to promote the organization, but now, even though we're a few years deep into the Affordable Care Act, we still think it's important to get the word out about our offerings. What we found most recently is that there are certain communities in Massachusetts maybe where the take-up could be greater. We're still there. We like, I don't want to say we like to think of them as, but sometimes you hear us talk about the hardest to reach populations. And there are different barriers for these folks potentially who are getting coverage. But we're doing much more with local ethnic media and trying just to get the word out not only in English but in other languages, so that people truly do understand that what their options might be.
Mm-hmm. I know that we're an organization that gets funded through the Healthcare Connector, and we have navigators, and we have both Portuguese and Spanish capacities, and we find that people really have a lot of questions, because this is very complicated stuff, regardless of what the president said, that he was going to make a better health care plan for everybody and cheaper and better, and it's just not that simple. This is very complicated stuff.
It's not that simple. Sarah, do you want to talk a little bit about the overall goals of the Navigator program,
Yeah.
so people really understand?
Right. So I will say that the Affordable Care Act created a program called the Navigator program, whereby there would be trained individuals, and PACE has navigators who are trained by the Health Connector to assist members of the public with their health insurance needs. The goals of the program are to increase awareness about the Health Connector and the programs that are available to individuals. Also to support them in their application and enrollment process, and also to serve as a resource for any of their post-enrollment needs. So, frequently people will sign up for coverage, but have questions. Maybe their life circumstances changed. Somebody in their family got a new job, and they want to know what that'll mean for their family going forward. And so navigators, fulfill all of those roles. They are the community resource. They, PACE in New Bedford in particular is the resource for New Bedford residents and the surrounding areas for them to access in-person assistance, so that if somebody has particular questions about their situation, their eligibility for the programs that we've been discussing, they can talk to somebody who they know has received a certification and a training from our organization to help with questions related to the Affordable Care Act. So those are the goals of the program, and it's a big way in which we try to make sure that individuals are being served, their questions are being answered, and that we continue to attract new members or people who need to access us for the first time, even though the Health Connector has been around, for over 10 years at this point. Some people may be new to Massachusetts, or just have a change in their life circumstances where they did not need to come to us for coverage before, and now they do. So to have those resources continue in the community does provide the opportunity for individuals to come in and get the help that they need.
Well, I know we looked at the statistics before we filmed this, and in the last 9 months we've helped over 1,300 consumers.
Oh,
We've had
fantastic.
over 350 applicants, new applications into the Health Connector, and actually 250 enrolled. And we get calls every day from people. And not only that, we've also, in the organization, we've also figured out a need of folks who are getting my age and are looking at Medicare and really not understanding it. I mean, I've been my healthcare administrative plan for the last 30 years. And when it came to Medicare, I had to ask people, geez, what do I do? What am I eligible for? When should I sign up? What are the plans? What do I need? Is there a prescription plan? It's really amazing how complicated it is. And you really need someone to talk to. You really need that face-to-face. And in going through the connector and filling out these applications, there's documentation that has to be submitted and things like that. So having that resource in the community is absolutely vital.
Yeah, so I think there's a plug that I do want to make, which is since the Affordable Care Act was passed, we've been able to externalize the application for health insurance so that people don't need to go into a hospital, health center, or even go in and get help. So we think that is really important for some members in the community to know about that. Those who maybe feel technically competent, or maybe feel like they can sit down with a family member and tackle the application. I like to think of it as sitting down and tackling your own taxes. As long as you've got everything in front of you and you've got your big cup of coffee, you can do it. Sit down and you can enter the information. However, that's not the case for everyone, and so we are really happy that we do have the Affordable Care Act required this Navigator program to be implemented. And I think that, like you were saying, people like to talk. These are big decisions.
These are big decisions.
These are big decisions. They want to talk it out, and I think it's wonderful to be able to talk it out with people who are doing this daily and can see different circumstances.
Yeah.
So
These are people too, I think, when they do come to us, they may be in a life transition, turning 26. You can stay on your parents' plan until that point, but then, maybe now you're facing that birthday and you feel confused or overwhelmed. That's a big life transition, potentially losing a job or maybe even going through a divorce. These are big life transitions, and it can help to have an expert, just like you would seek an expert for other areas like, your tax return. You seek the navigator who is really there to navigate you through the process of gaining this coverage and making sure that you're following and completing all of the steps to enroll.
So people are technically savvy, can, as you said, access the information. My kids grew up with computers. I mean, they're great at it. I didn't. I mean, calculators were new to me, back when I was growing up. So a lot of folks in my age group, they didn't grow up with computers. They're not technically savvy. Not that they don't know how to use computers, but having that person sit down, be able to answer your questions, and help you through the process. Not that it's the most difficult process, but if you're not used to doing things on the computer like that, they can be a little bit intimidating.
right, it might not be your preferred method of getting something done. The Health Connector does have, in addition to the online application, we do have customer service center dedicated to help individuals and families, and they can assist over the phone, even if necessary, complete an application over the telephone if that's what the consumer wants. But we like to promote the in-person assistance because we think that for those consumers that want or need that in-person assistance, they tend to, we hear that they tend to be repeat customers, and they develop a relationship within their own community with someone that they can trust and ask questions to. Because once they do, the goal really is, of course, we want people to have health insurance coverage, not just to check the box and say, yes, I'm being compliant with the individual mandate. We want to think about this in a much more holistic way. We want people to be able to access their coverage, use their coverage, ultimately be as healthy as they can be. So after they get the coverage, they might have other questions.
So let's talk about your successes.
Okay.
What's the percentage of people who have health care in Massachusetts?
Oh my gosh, I'm going to get it wrong.
96.3% currently of residents have health insurance that meets all of the compliant.
So I just want to be clear, there are 3% that do not.
Yes,
so
there are still
yes.
3%.
But nationally,
it varies state
by
to
state.
state, depending on that state's particular mix of their Medicaid program and other factors. But Massachusetts does lead the nation in health care coverage. So Massachusetts has the most residents covered, and we're committed, to making sure that we remain that way and try to get to 100%.
well, we've got some of the best hospitals in the world, with some of the best healthcare in the world, and I want to thank you for bringing your message here to New Bedford. You do a great job. I'm proud to live in Massachusetts. I'm proud that we're the leader in many things in the country, and I want to thank you for the work that you do.
Thank you.
Thank you for having
Thanks
us.
for having us.
Thank you for watching PACE Monthly. I hope you found this informative, and if you have questions about healthcare or health insurance, please call us at PACE.